talking about marijuana. There's been a lot of stuff in the press lately, in the media, about whether this drug should be legalized, that it may have uses for medicinal purposes and such. And I want to be the first to say that if I've got a patient who's dying of cancer and who would benefit from the use of medical marijuana for the treatment of nausea from chemotherapy and such, I'm not going to argue about that. It is a drug that may have its place in medicine in a very limited area. However, it has always intrigued me that when we talk about the use of this drug for things like glaucoma and such, people point that we ought to legalize it because it could be useful there. And indeed, we have drugs that work better. So we have to be very careful about some of that argument. Suffice it to say that while marijuana may have a place in medicine in very special and limited areas, we must remember that it is a dangerous drug that can cause significant problems. In the 60s, a lot of research went on with marijuana that marijuana advocates still tend to promote. They still tend to look at that research and say, see, this was a very benign drug with minimal problems and minimal side effects. Well, a couple of things have happened since the 60s that we need to take into account when we talk about marijuana today. The first of those is that we now have 30 or 40 years more experience with the drug. We're able to look at people who've used marijuana for that duration of time, not just a couple of years, but have used it for 20 years and 30 years and 40 years, and get a look at the long-term effects of taking the drug on a regular basis. Plus, if you bought 1965 grade marijuana today, if you were a regular user of marijuana, you would probably go out and try to find the dealer who sold it to you and beat him up because it was such low quality compared to what's purchased today. Back in the 60s, the average strength of marijuana, the average amount of active ingredient, which is a chemical called THC, averaged somewhere between 1 to 5% at best. Today, average street grass is around 10% THC content and has even been registered as high as 17, 18%. So we're talking about a much stronger dosage of the chemical. Another way to look at that is if I have a headache and I take a couple of aspirins to relieve that headache, that's probably not going to hurt me. But if I take 10 times that amount in strength, I'm going to end up with a very irritated stomach, perhaps an ulcer, and perhaps even bleed and get seriously sick. So there's two things that have changed with marijuana over the years. Its strength and the duration that people have used it that have led us to consider it as a much more serious chemical than we used to. Let me cover quickly a few physical problems with marijuana. The average marijuana joint will contain anywhere from 3 to 10 times as much tar as a typical cigarette. Now, it's tar that contains the ingredients that lead to cancer, emphysema, chronic bronchitis, all of which are more common in the marijuana user. There's no doubt, scientifically it's been well proven, that marijuana users have a much higher incidence of chronic bronchitis. You hear them coughing all the time. A much higher incidence of what we call chronic obstructive pulmonary disease, which is a fancy medical term for emphysema, which just basically means the lung tissue is breaking down. They can't move air back and forth as readily. And there's even a growing body of research that shows it can increase the odds of developing lung cancer. That's not 100% yet, but there are studies coming out of Chicago and California which are very, very strong in that direction. Plus, when you look at the chemical ingredients of the tar in marijuana, which, by the way, the marijuana user doesn't call tar, they call it resin. When you look at that ingredient list, it's very similar to tobacco and contains the same carcinogens or cancer-causing agents as tobacco, and in many cases in a higher percent or a higher quantity than you would find in tobacco. So right away we have the problem with regular use of marijuana causing lung damage, possibility even of lung cancer. Another really important area, and I remember back in medical school seeing a simple piece of research done on this, our demonstration actually. Marijuana, the active ingredient THC, does not dissolve well in water. As a matter of fact, it hates water. If you mix some THC, pure THC and water together and shook it up in a bottle and set it down, it would separate out like oil and water. However, THC loves fat. It dissolves very readily in anything that's fatty. Well, in our blood, we have basically two kinds of cells. The red blood cell, which carries oxygen around, and white blood cells, various types of white cells, but basically their job is to fight off infection. They're part of what we call our immune system. THC dissolves readily into the fatty white blood cell. And a white blood cell that has THC dissolved in it behaves differently than a cell that doesn't have it. A white blood cell under the effects of THC becomes, if you want, lethargic and apathetic. The experiment I saw in medical school was taking some white cells from a student who was a volunteer who was not a marijuana user, putting those white cells in a dish where we could look under a microscope. The dish was full of sewer water, and watch the white blood cells attack the bacteria there. And literally there was a war going on under the microscope. Then after he smoked some government-provided marijuana, which was pretty weak in all honesty compared to today's marijuana, waited 20 minutes and drew blood again and repeated the experiment and watched what happened, you could see the white cells swimming around, literally bumping into bacteria and not aggressively attacking them. The resistance to infection, therefore, in the marijuana user is reduced. It affects the immune system. And in today's world, where there are many new contagious diseases which we're getting less and less good treatment for, that could become extremely relevant. It also points out why we see things like bronchitis so much in the marijuana smoker. Not only does the smoke and the tar irritate the lung tissue, they don't have the ability to fight off the infection that you would normally see. So now we have two common physical problems to worry about with grass. One, the effects on the lungs, and two, the general effects on our immune system and our ability to fight off infection. But that's not why people smoke grass. They don't smoke it because of what it does to the lungs or the blood. They smoke it because of what it does up here. They smoke it because they like the marijuana high. Well, we really haven't gotten very far compared to other drugs of abuse in trying to understand how marijuana affects the brain to cause the marijuana high. All the other drugs of abuse, the opiates like heroin or cocaine or amphetamine, we've been able to locate inside of the brain cell, or on the surface of the brain cell, what are called receptors. The brain makes chemicals like norepinephrine, serotonin, a whole bunch of them, dozens of them. And one brain cell has to release those chemicals, and it floats across the space and reacts with a receptor in the other cell to get it to fire off electrically and communicate back and forth. We've found receptors for opiates. We've found receptors for all these other drugs. We never really had a good receptor for marijuana. And since the 1980s, they've been looking for that receptor. In 1986, it was discovered that THC, the active ingredient of marijuana, stopped an enzyme inside of the brain cell from working very well. And that meant there had to be some kind of a receptor on that brain cell that the marijuana was affecting. In 1991, they found that receptor. They actually had been searching for some natural ingredient in the brain that would fit into a receptor that would have that effect on the enzyme, and they were able to find it. It was found initially in pig brain, pork brain. Now, the name of that naturally occurring substance is anandamide. That doesn't mean much to you, but it's a significant breakthrough because now we have an explanation as to how marijuana slows up the brain. Basically what happens is the THC fits into that anandamide receptor. That brain cell then, an enzyme inside of that cell shuts down. That enzyme is very important in making, if you want, the energy that causes that cell to function. When it doesn't have the energy, it would be like a person not having food. That cell slows up. But there's another very important action of marijuana that we've known about for a long, long time. THC, as I mentioned earlier, does not dissolve well in water, dissolves well in fat. The wall of your brain cells are about 99.9% fat. Now, in animal studies, we can't do this in human beings because in order to do this work, you have to have biopsies or pieces of the brain over periods of time, and people aren't going to volunteer for you to do that. In animal studies, we've discovered that if someone smokes an animal, usually they use a monkey, smokes the equivalent of 3 joints a week after a period of just a few weeks, 2 to 3 months at most, if you biopsy that brain, you will discover little globules of THC, like fat droplets that are dissolved in the wall of the brain cell. That's not very impressive when you look at it underneath the microscope. But if that animal is continued to give marijuana for a period of time beyond 3 months at a rate of 3 or more joints per week, within a matter of months, the whole wall of the brain cell becomes profoundly thickened by these deposits of THC in it. The thickness of the cell wall can actually get up to, and this is an unbelievable figure, 400 times as thick as it's supposed to be in animals that are heavy users of marijuana. Now, this is critical because for the brain to function, chemicals have got to get out of brain cell number 1, pass through that wall, and get over to brain cell number 2, where it will react with receptors. It's much harder for those chemicals to penetrate something that's 400 times as thick as it should be. It's pretty easy to tear a piece of paper. That's a little harder to tear a piece of paper that's 400 pages, or a book that's 400 pages. So I think you can picture what's going on here. We believe that the combination of the receptor being hit with the THC, plus the thickening of the cell walls, explains some of the pharmacological effects of marijuana. Now, one of the pharmacological facts of marijuana that's very important is the body doesn't get rid of chemicals very readily that are fat soluble. It takes longer. If a drug is soluble in water, the body eliminates it quickly. Example, a drink, a beer, let's say. An adult body will get rid of 1 drink per hour. So the half-life of a beer is about 30 minutes. The half-life of marijuana is not exactly as well known. It's somewhat variable. It depends a little bit upon the body weight of the person, how much fat they have, any previous usage of marijuana, so that their body becomes familiar with it, so to speak, and maybe can eliminate it quicker. Generally speaking, the half-life of marijuana appears to be at a minimum 48 to 72 hours. That's why the AMA has said if you smoke more than 3 times a week, you're always putting more THC into your body before you get rid of the THC from the previous joint. So anything over 3 joints a week is usually defined as heavy smoking of marijuana. Now, let's get back to some of the pharmacological effects. The receptors that marijuana fits into, that I mentioned earlier, tend to be concentrated in different areas of the brain, and we know what those areas of the brain kind of control. For instance, there's an area of the brain that sits kind of to the back of our heads called the cerebellum, and there are a lot of marijuana receptors in that area. The cerebellum is really important in what we call fine motor control and your sense of balance. Well, one of the things that we've discovered that chronic marijuana use affects rather profoundly, for instance, is fine motor control. Now, what does that mean? If I have 2 or 3 drinks, my reflexes are going to be considerably slowed. That's pretty well known. If I smoke a joint, my reflexes for simple things will not be that profoundly affected. But when the reflexes called for are more complicated, for instance, it may involve the moving of my eyes to track a moving object, or picking up things in my peripheral vision, and some very fine movements of controls, then the marijuana affects it profoundly, and partly because of its effects on the cerebellum. Another area of the brain that marijuana tends to concentrate in is what's called the hippocampus. That's a technical term for an area of the brain. But what's important is that's an area of the brain that is profoundly important in memory, especially in recent memory. And more studies are pointing that marijuana usage causes profound impairment of recent memory. Well, that's the memory we use for learning. What we frequently will see, therefore, for instance, is, let's say, a youngster who starts smoking some grass in junior high or high school and starts by the time they're in their junior or senior year to be a regular user of marijuana. We see a definite progression in the deterioration of their academic performance. They can't remember things as well. Actually, in the chronic user, this leads to what's been called the amotivational syndrome. This is an individual who really has to focus on the here and now. They really only have an interest in if you want immediate gratification. A good example of that that has always bothered me is when I'm on the checkout line at the grocery store and they have all the candy right by the cashier, and you watch the child get very upset, grabbing a candy bar or grabbing a pack of gum and wanting mom or dad to buy it for him, even though they just bought a pack of 12 in the grocery store to take home. And the child won't accept, wait a minute, when we get home you can have some candy. They want gratification and they want it now. Now, I'm not saying that chronic heavy users of marijuana act like that little child, but they do have great difficulty in postponing immediate gratification for a reward further down the line. You put that together with the impaired memory, and you have a person who's very likely to drop out of school, drop out of work, drop out of activities, drop out of the social life. They become very focused on obtaining the drug, using the drug, and when they're going to get high the next time. The major issue, for instance, for the high school kid might be, where am I going to buy some grass for this weekend? Where's the party going to be at? Rather than looking at school, at work, and possibly trying to go on to a higher education. So that's a profound effect of marijuana. In most people, it tends to increase the appetite, sometimes called the munchies, and there may be weight gain associated with it. In some people, the perception of time, the passage of time is altered. That's a real common effect of marijuana. Person really has trouble knowing exactly how long they've been doing something, especially when they're using. There are a few people who, when they smoke grass, seem to have a panic-like reaction to it. These are usually naive users, people using the first or second time. And I have had a few clients over the years where that effect on them led them to a chronic state of anxiety and repeated panic attacks to where they needed major psychiatric help. In very high dosages of extremely potent marijuana, people have even been known to have mild visual hallucinations. That's extremely uncommon, however. Some people will experience a sense of unreality, of depersonalization, almost like they leave their body. I've heard that expressed by a number of clients. These are frequently the same people who have the anxiety panic attack type of reaction to the pharmacological effects of marijuana. Now, one of my major concerns about this drug is that long half-life. When I get a patient who comes to me with a drug problem, it may be marijuana, it may be other drugs, it may include alcohol, but where marijuana is one of the problems involved. The hardest thing for me to have to tell them is, from the research that we have, it may take up to 2 years of total abstinence from marijuana for it all to be out of their brain. The body gets rid of the buildup that slowly. Now, that's determined by animal studies, so it's always a little difficult to know if that's exactly true in the human being. But certainly in monkey studies and rodent studies, it can take up to that long for the brain to clear out completely the THC from regular, heavy, long-term use of marijuana. Let's try to put some of this together. We have a drug that accumulates in the brain over time, slows up the brain through its reaction with the marijuana receptor and with the thickening of the cell wall of the functioning brain cell, affects things like fine motor control, eye movement and tracking of a moving object, peripheral vision, coordination, memory, learning, et cetera, And let's try to illustrate how that affects a human being in a day-to-day situation. A simple experiment that has been done with marijuana versus alcohol, I think, can illustrate this. If you take a person and you sit them down at a table and there's a light that goes on, and as soon as that light goes on, they have to hit a switch. You can time that and see how various drugs affect it. Well, a couple of drinks, a couple of beers, a couple of mixed drinks, a couple of glasses of wine will really slow down a person's reaction time to that light and switch. Joint of marijuana will slow it down, but not nearly as much as alcohol. It's really quite minimal. But if you make the situation a little more complicated, a little more complex, example, red light, a green light, and a yellow light, and you have a red and a green and a yellow switch, and you now have the person smoke some grass and you time them, and you say, look, when the red light goes on, hit the red switch, the green, the yellow, the yellow. That will be significantly more slowed down than if it was just one light